Okay, Brandon, this is what I do when I pull up the link. The slideshow comes up. I go up here to slideshow, click on slideshow, and it starts playing. This is Group 2's presentation on telemedicine. Myself, Jeff Jenkins, Rachel Gustafson, and Justin Porter. Telemedicine is described as a remote diagnosis and treatment of patients by means of telecommunication technology. Telemedicine can include a lot of different forms of technology, like two-way radios, email, smartphones, and probably the most popular technology used are tablets and iPads using FaceTime and Skype. Telemedicine isn't a separate medical specialty, it's more of an investment in providing medical convenience through information technology. It was originally an idea that would allow physicians the opportunity to reach out to remote communities by providing basic medical care, at least as far as diagnosing is concerned. The reimbursement fee structure has pretty much stayed the same as far as physician charges go. The big difference is in the reduction in cost because there's no facility cost involved with the telemedicine. With remote telemedicine services, there are fewer overhead costs to worry about, so charges to the patient can be reduced. Also, CPT coding pretty much remains the same. As I stated earlier, the savings to the customers because there is little to no facility costs. What began as an idea to better serve remote areas of the country is finally starting to live up to its potential. Besides providing physician care to remote locations, telemedicine is now also being used in hospital patient rooms to monitor patient vitals and observing patients while they're sleeping and when they get up to use the restroom for fall risk patients. It also provides continuing medical education opportunities for staff members and in consumer-focused wireless applications. What specific applications do telemedicine provide? Well, primary and specialty care referral services by providing diagnostic consensus between physician groups. It also allows for remote patient monitoring. It provides for collecting and sending medical data for interpretation. It also provides consumer medical and health information, which allows consumers the opportunity to research strong, authoritative, specialized health information. So there's no more misleading, I heard it through the grapevine type of medical information that's provided when patients do Google searches. It also provides for support group discussions. And lastly, it provides special medical education seminars for remote targeted groups, like for continuing education credits and the CME credits. So, what does telemedicine do for our communities? It provides accessibility not only for those remote areas, but also for convenience within hospitals and clinical settings.
Telemedicine has had a positive impact on healthcare. It's proven to be cost efficient, save money to patients, providers, and payers. With patients, most people are pressed for time, and it's not always possible to take time from work or other responsibilities throughout the day for an in-office doctor's appointment. We all know how a doctor's appointment can turn into a 2 to 3 hour ordeal, and that's time away from work, and time is extremely valuable. Televisits are also less likely to be delayed, so patients are able to take care of minor health problems and save money in the fact that they could turn into something major down the road. So in reality, they're acting on their health quicker because it's easier, way easier access. For physicians, they're going to save money on overhead. They can also bill the same as an office visit, and as long as they provide quality care, they're going to maintain patients. Payers are going to save money it's much cheaper to pay an approximately $50 telemedicine visit versus $100 doctor's in-office doctor's visit or a $200 to $400 ER visit with non-emergency things that can be handled via telemedicine. Telemedicine has been around for quite some time. It's only been of recent years that the technology has been good enough to allow a physician to evaluate a patient effectively. Telemedicine has proven to improve health outcomes at all levels. And this is because the video equipment is extremely high quality, the use of smartphones, extremely fast internet services, and this has been proven through research. You look at patient satisfaction scores, they remain extremely high. And this is something that people have been really skeptical about, but it's backed up by research now, and it's gaining a lot of popularity. You're starting to see marketing all over the place and different healthcare systems introducing it available. Telemedicine has proven its effectiveness in a family practice setting. It's recently been expanding in different areas of healthcare and proven to be effective in those. Here we're going to look at how it's affected the ICUs. So telemedicine version of an ICU is called an eICU, which uses state-of-the-art technology. The provider can be down the hall, in a different floor in the hospital, or in a different state. They can be monitoring these patients through two-way cameras, video monitors, microphones, and smart alarms connected with a high-speed data line. A lot of this equipment is specialized and produced for telemedicine. Here it shows a 5-year study that involves over 118,000 ICU patients from 56 different ICUs. And these are the results using the eICU technology compared to the normal ICUs. 15% increase in discharge time, 26% fewer deaths. That's a pretty big difference. And then the 90% reduction in incurred cost, that seems very high. And this is because of malpractice costs, money that's spent going to court over stuff that wasn't documented correctly. With telemedicine, everything's recorded, so your documentation is going to be much better.
Okay, so there are several concerns regarding the impacts that telemedicine can have on the care that we provide. Number one, we're worried that it's coming too close to our limits technologically. Things like poor broadband connections could end up affecting the quality of care that a patient receives. Telemedicine already can present kind of a difficult circumstance for providers to provide care, and things like poor connections can lead to mismanaging patients' health. Another concern is decreased continuity for patients, especially for those that are only seen for acute cares like rashes or sore throats, and then will not be seen again until they have another similar occurrence. All of the patients that don't necessarily have a primary provider, and then they don't receive any type of preventative care. Along with that, we also have poor quality of patient histories, which can be very valuable when diagnosing a patient who has what may look like a common ailment but could end up being something else. And another issue is fewer in person consultations, which is again more likely to occur with patients such as those that only seek medical help when they have some kind of ailment rather than seeking preventative care. And the final concern is that of policies, reimbursement, and rules relating to telemedicine. There are facets of healthcare that are changing constantly to begin with, and there's worries that they won't necessarily be able to keep up with telemedicine as it's not only brand new, but it's quite different than anything else that's happening in healthcare. And of course, privacy is a major concern as we want to protect our patients' health information. There will have to be some thought put into how we can ensure this same level of privacy will be provided when using telemedicine as when a patient is seen in office. Fortunately, when it comes to telemedicine, there does seem to be more benefits than concerns. One would be that it could actually improve the quality of care that patients receive. Despite the fact that telemedicine allows for certain opportunities for care to be subpar, it does help to address the shortage in primary care providers that is currently facing a lot of the U.S., especially in rural areas. And for providers who do often travel to rural areas to see patients, they can now spend a significant amount of time with patients that they used to be spending traveling due to telemedicine. Another potential benefit would be e-technologies, which have the ability to improve the efficiency of care. Patients are able, through these technologies, to describe their illness, and then these technologies not only translate it into medical terminology, but they are able to code whatever the patient inputted for things like chief complaint, ICD-10 codes, etc. And then they can actually rank the patients based on the severity of the data that they've input. A couple of additional benefits are that telemedicine can be especially helpful when providing certain populations with care. An example is the idea of telepsychiatry. Telemedicine can be extremely helpful in providing therapy to certain populations. And another would be using telemedicine when providing care to children who are actually excited about the idea of taking a robot home to conduct virtual visits and monitor their condition. One benefit for patients using telemedicine would be that it improves access to care, especially for acute cares. It can help to reduce the number of instances of patients waiting for hours in the ER or having to reschedule their entire day so they can make an appointment for a common ailment. They also have improved access to specialists, particularly patients who live in rural areas where their hospitals wouldn't be able to support the various specialists that they may need. This way they have access to those specialists without having to travel. Also, telemedicine has the benefit of cutting costs for many types of visits, such as I discussed, when a patient has a common ailment and can use telemedicine rather than going to the ER. Some problems that telemedicine could pose would be poor care continuity. Namely, it might be difficult for a patient's primary care provider to access medical records if a patient does use telemedicine, and this can create gaps in a patient's medical records. Additionally, for patients who really enjoy establishing a rapport with their physician, telemedicine can make this difficult. Okay, so some final thoughts regarding telemedicine and its potential within the healthcare industry in the US. It likely won't be by any means a perfected system anytime soon, but the probable benefits definitely outweigh the cons, and it will continue to be an exciting and helpful tool for patients as it does continue to evolve. And this concludes our presentation on telemedicine. Thank you.
References, the end.